Hello everyone. I'm going to be doing the video just with my voice about the infant feeding, just to help us move along. So there are your objectives. And you'll hear me quite often refer to the AAP, which is the American Academy of Pediatrics. We all know what UNICEF is. A1, Association of Women's Health, Obstetrician and Neonatologists, and the World Health Organization. So a lot of people weigh in on infant feeding. And here it is. American Academy of Pediatrics, the AAP, recommends exclusive breastfeeding for 6 months of life. And that means no water, no other added food whatsoever. Except when the mother's or infant's medical condition contraindicates breastfeeding, which we'll talk about that too, and there are very, very few contraindications. But the AAP reaffirms its recommendation, followed by continued breastfeeding as complementary foods are introduced, with continuation of breastfeeding for 1 year or longer. That research, and you can see AAP, the AAFP is the American Academy of Family Practice Physicians. And then the CDC, you know who that is also. And there it is. Exclusive breastfeeding means that the infant receives only breast milk. We used to give them formula, but no longer. And also, this came out in 2012. Per the American Academy of Pediatrics, there was a policy statement. Given the documented short and long-term medical and neurodevelopmental advantages of breastfeeding, infant nutrition should be considered a public health issue. Those are strong words. A public health issue and not only a lifestyle choice. Health outcomes are best when the baby is breastfed for 2 years. And that's, again, after 6 months, we're going to be introducing food. It's not just exclusive breastfeeding, but they want them to be exclusively breastfed for the first 6 months. And here's a breastfeeding report card. You can see they're going to be doing it every 10 years. And in 2010, they said breastfeeding initiation, meaning we were going to at least initiate it in the hospital, was at 75%. Actual was 73.9%. And the 2020 goal for healthy people, they're saying they wanted it at 82%. And I think that could be 100. Initiation is most kids are born in the hospital. Breastfeeding at 6 months, as you can see, the 2010 goal was 50%. We fell short of that, at close to 43.5%. And the 2020 goal, they've increased to 61%. Exclusive breastfeeding at 6 months, look how it dropped from the initiation from 75% to 17%. That's just crazy. And so are we doing enough teaching? I don't think so. Actual was 73.9 for initiation, and now actual was 13%. 2020 goal, again, 82, and the 2020 goal is saying 24%, which I don't understand why that's not at 50%, but that's the way it is. Breastfeeding at a year, again, 2010, 25%, and the 2020 goal is going to be 34%. I want to make a note here. Exclusive breastfeeding for more than 3 months reduces the risk of otitis media by 50%. That's a middle ear infection for an infant or newborn. Serious colds and ear and throat infections were reduced by 63% in infants who exclusively breastfed at 6 months. So the United States has not yet met its breastfeeding goals. Data published by the Centers for Disease Control and Prevention, which is the CDC, show that in 2011, 79% of U.S. mothers initiated breastfeeding. Again, 49.4% were breastfeeding, and 18.8% were exclusively breastfeeding at 6 months. Despite growing evidence of health risks of not breastfeeding, physicians, including family physicians, do not receive adequate training about supporting breastfeeding. That's what the literature is showing. So again, it goes back to education. Although physicians make health recommendations about many aspects of infant care, many physicians still worry that advocating for breastfeeding will cause parental guilt. However, parents may feel less guilty if they have had an opportunity to learn all of the pertinent information and can make really more of a better informed choice. And here I just listed, if you ever want to look into it, these are just a few of the associations, academies, educated people that are backing breastfeeding. They have several different facts on breastfeeding. With all of the health advantages of breastfeeding for moms and children, as well as its economic and ecological impacts, breastfeeding is a public health issue, not merely a lifestyle choice. That's what they're saying now, today. Family physicians should work in their communities to advocate removal of barriers to breastfeeding. This could include overcoming cultural issues, encouraging breastfeeding friendly workplaces. And that has gotten much better. Actually, state laws in this state where they have to provide a place for a working woman to be able to breastfeed in privacy, not one where, everybody uses the room. Let's see. Medical schools and family medicine residencies should include appropriate curricula in lactation physiology and breastfeeding management so that family physicians are adequately trained to provide care to breastfeeding moms and infants. And that came from the American Academy of Family Practice Physicians, 2014, that statement. So sociocultural cultural influences on breastfeeding. You can see breastfeeding, and these are just all statistics that, people have done studies on. Lowest, and you can see African Americans, Hispanic, Native American, and Asian Pacific Islander women among young, uneducated, and poor women, regardless of race, which is interesting because they may need it the most. Culturally aged and developmentally appropriate information should be incorporated into breastfeeding promotion, support, and education whenever possible. Health benefits or infant health benefits of breastfeeding. Breast milk, we know, contains all the nutrients needed to support newborn brain development and growth. It provides a very strong immunologic link, protection against infection, childhood and adult onset diseases, which we're going to look at. Perfectly matched nutrition. So, because it's perfectly matched nutrition to the human body, it's very easily digested. May protect against SIDS, that's sudden infant death syndrome, and it may enhance cognitive development. They've been talking about that for 30 years, but they're having a hard time proving the whole IQ development. So that's just a few of the infant. Maternal health benefits. Promotes uterine involution. Well, we know what that is. It's that contracting of that uterus back down to where it needs to go. Facilitates the return to pre-pregnancy weight. The weight falls off you, ladies. If nurses would sell it like that, every woman in the world would breastfeed. It will just, because think about it for a minute. Your body is sped up. Your body is producing, it's got an increase in metabolic rate. And so your metabolism's quicker. And if you're eating decently, in fact, you actually get to eat 500 calories more a day and the weight's falling off. It doesn't get much better than that, ladies. May decrease risk of osteoporosis, ovarian, and premenopausal breast cancer. So the GYN, the gynecological breast cancer, or cancers, and then a softening of the bones. Facilitates bonding and maternal role attainment because you have to hold the baby. When you're bottle feeding, anybody can hold the baby. But if you're breastfeeding, the mom has to hold the baby for feeding. Decreased risk, of postpartum depression, and very, very convenient. It's there. It's always the right temperature. It should be the right amount. If the baby's going through a growth spurt, they're going to let you know. You just put them to breast more, and that way it's all supply and demand. The more the baby sucks, the more milk you're going to have. Let's see. Infant health benefits of breastfeeding. And this is where it gets a little crazy. There are so many diseases it can impede and not allow to happen to babies. It decreases the incidence of bacterial meningitis. Folks, most of the time, if a child under 5, even 5 to 7, gets bacterial meningitis, it's usually a 12-hour disease or less, and they die. It is a horrible disease. So decreases the incidence of that. Bacteremia, which would coincide with meningitis, diarrhea, respiratory tract infections, which we already talked about, including otitis media or middle ear infection, necrotizing enterocolitis, which is where the bowel gets necrotic because of lack of blood supply. And that's when we're talking about our premature babies. UTIs, late onset sepsis in preterm infants. In addition, post-neonatal infant mortality rates in the United States are reduced by 21% in breastfed infants because our NICU kids are always at higher risk for everything. And here we've already said it a couple times, decreased rates of SIDS or sudden infant death syndrome in the first year of life. And that's when it happens. Look at this. This is all new when I started studying this. In my master's program, I actually wrote the breastfeeding policy for St. Jude's Hospital, which they actually adopted. And I knew bonding. I knew about the infections, such as meningitis and middle ear infections. And I knew about the weight loss in women because of the increase in metabolism. I had no idea that it reduced both types of diabetes. Insulin-dependent IDDM type 1 and non-insulin dependent or type 2 diabetes mellitus. Look at the blood cancers. All leukemias, AML, ALL, lymphoma, both non-Hodgkin's and Hodgkin's, obesity, hypercholesterolemia, which is going to lead to all kinds of cardiac diseases. And the newest finding is asthma in older children and adults who were breastfed. It's going to diminish all of that. Let me tell you, if nurses went in and educated on this, I don't know what mother in their right mind would not, if nothing else, at least give them the colostrum or try to do that 100% up until 6 months. I don't know anyone in their right mind if you told them that, you're going to keep your child from getting one of the childhood blood cancers, such as leukemia or Hodgkin's or lymphoma. So economic benefits for breastfeeding for the family would be it's less expensive than bottle feeding. You're producing it. Perfect for the baby. You're losing weight. Don't have to spend any money. Overall infant care costs are less than formula-fed infants. Women who breastfeed have fewer days lost from work than women who formula feed. And also what that means too is because the kids don't get sick. They don't get sick as often. And if they're not getting sick, you can also stretch this a little bit more and say that they can spend more time with the other children. Less cost of government programs and public health care, reduced risk, again, of cancer, diabetes, and obesity, and that's for breastfeeding as a whole, as a society, because we know, cancer is just debilitating every which way, and diabetes is a death sentence. We know that because it affects our blood, which goes everywhere. Okay, I'm going to stop right there because these only go for so long, and I will be right back with the second part of this presentation.